Well, good afternoon, everybody. My name is Gabriel Spitzer. I'm part of the communications team here at Public Health Seattle and King County. Thanks for joining us for this briefing with our health officer, Dr. Jeff Duchin. If you have questions, we will be sure to reserve some time for Q&A at the end, and you can use the raise hand function in Zoom to let us know. And with that, Dr. Duchin, the floor is yours.
Thank you, Gabriel, and thank you everyone for joining us before the holiday weekend. Today, I'll provide an update on the status of the COVID-19 outbreak in King County. Today's COVID-19 forecast is looking good for the holiday weekend for most of us, with lots of sunshine, but a chance of rain persists in some areas. Since the peak of our fourth wave in late April or early May, cases and hospitalizations have been decreasing throughout the county. Wonderful news. Over the last 7 days, Public Health has reported 155 new cases daily, which is down by 64% from our recent peak of 432 cases a day in late April. We are now at the level of COVID-19 transmission we were at just before the recent fourth wave started, and about double the level we were at in late September 2020 before the start of the large fall-winter peak. Incidence rates among all age groups are decreasing. COVID-19 rates in younger people are highest currently, as they have been throughout the last several months in our recent fall-winter surge. And we have the highest rates in 5 to 17 and 18 to 24-year-olds that are about 3 times higher than that for adults 65 and older. And incidence continues to be highest in the cities in South and Southeast King County, as we've discussed previously. Also good news, our average daily hospitalizations are falling. They've fallen by over 1/2 from the peak of 23 a day in late April to 10 a day currently. That's 1 King County resident currently hospitalized every 2.5 hours. The 14-day incidence rate is currently 147.5 per 100,000. That translates into a substantial level of transmission by the CDC criteria. The 7-day hospitalization rate is currently 3.5 per 100,000, which is comparable to what we see with respect to hospitalizations during a moderate to severe flu season. We continue to see about 1 death due to COVID-19 reported every day. With respect to the variants of concern, there are more than 3/4 of COVID-19 samples that are currently sequenced in Washington state are variants of concern. The B.1.1.7 is the most prevalent variant identified. P1 is also increasing recently, and the B.1.617 strain that was first detected in India and recently identified by CDC as a variant of interest is also present and increasing in King County. This means that those viruses that are out there are better at spreading from person to person if you're unvaccinated. So although we're making great progress, our current disease rates are still about 5 times higher than they were last year at this time. And hospitalization rates are 3 times higher than our low point last spring before last summer's surge began. So we're moving in the right direction, but we're not down as low as we need to be or would like to be. At this time, our outbreak is being felt primarily by the unvaccinated. Approximately 500,000 people 12 years of age and older remain unvaccinated, and 97% or more of current cases are among unvaccinated people. That means if you're unvaccinated, your risk of COVID-19 is actually higher right now than it was last Memorial Day. And although I don't expect to see a summer surge similar to what we saw last year, people who are unvaccinated are at significant risk and need to continue to take precautions, including limiting indoor activities with other unvaccinated people, distancing, and wearing masks indoors when they're around others. This is especially important over this Memorial Day when people may be gathering. Outdoors is great. Indoors, think about precautions. And because there will remain unvaccinated people, and many people who do not respond to vaccine due to underlying immunocompromised and medical conditions, and recognizing that no vaccine is 100% protective, We need to continue to focus on improving indoor air quality through increasing ventilation and use of filtration strategies in our businesses, workplaces, retail locations, and anywhere people gather indoors. But thanks to vaccination, we are in a much better place now as we head into summer, as we had hoped for. And I'm optimistic that the burden of COVID-19 will continue to decrease over the coming months as more are vaccinated. Now I'll pivot to talk a little bit about our vaccination progress. Among King County residents 16 years of age and older, 75% have now received one dose and 63% have completed the vaccination series. That completion rate of 63% is up from 57% last week, and we are on track to have 70% or more of 16 years and older fully vaccinated by the end of June. This week, 61% of people between the ages of 12 and 40 have received one dose, and 45% have completed the series. And that's compared with 57% receiving one dose and 40% completing the series last week. Completion rates are 20% in 12 to 19-year-olds, which is up from 16% last week, and 48% in 20 to 29-year-olds, which is up from 42% last week, and 56% in 30 to 39-year-olds, which is up from 50% last week. Completion rates are 41% among Black and 41% among Hispanic community members, so both at 41%, and those are up from 38 and 36% respectively last week. And that's compared to 58% completion among white residents, and that's up from 54% last week. So although disparities in vaccination coverage, along with our substantial COVID-19 disease rates, were important reasons that I issued a directive for everyone in King County to continue wearing masks in indoor public spaces last week. We are making progress, and every week we're seeing more and more people vaccinated as our disease rates come down, which is exactly what we need to see. With everyone continuing to wear face masks in indoor public spaces, it helps us all stay safer as more become vaccinated and disease rates continue to decline. And as I just illustrated, we're continuing to make progress across all age groups, although vaccination rates do continue to lag in regions of the county that have had the highest COVID-19 disease rates, including Auburn, Kent, Federal Way, Burien, Renton, Tukwila, SeaTac, and Southeast King County. Now, with respect to these gaps in the large number of people who remain unvaccinated yet eligible, we're trying to address this through several strategies. We're doing whatever we can to make vaccine available and convenient, including providing regular vaccination access during evenings and weekends. And this includes increasing our mobile vaccination teams, which visit people who are homebound, living homeless, as well as holding vaccination events at bars, employment sites, sporting events, and other venues. We're continuing to partner with community groups to hold pop-up vaccination events at community centers, churches, and other places where people gather. And we're working with school districts to hold school-based vaccination events. And there have been over 100 first dose clinics completed or scheduled. And we know that our healthcare providers are the most highly trusted sources of vaccine information, and that the majority of parents prefer their children receive vaccination from their family physicians. So we are working with our King County healthcare providers to support them in integrating COVID-19 vaccination as part of their routine patient care. And similarly, we've had great success in vaccine delivery at our local pharmacies and community health clinics, and this access will continue. So as we invest in these strategies, we're also consolidating our high volume sites so that there's at least one high volume site in each region of King County. There'll be the SODO region for Seattle, for East King County, the Redmond site, for North King County, Shoreline Fire, and for South King County, Kaiser Permanente, Renton, as well as our Kent and Auburn sites. And to continue to best serve South King County, which has been particularly hard hit by COVID, we're adjusting schedules at our Kent and Auburn high volume vaccination sites so that the Auburn site will now be open Sunday through Wednesday, and the Kent Showware site will be open Wednesday through Saturday. So we'll have 7-day-a-week coverage plus 2 evenings per week. I also want to update you a little bit on the myocarditis situation. I know there was a briefing by Washington State Department of Health about this yesterday. I want to let you all know that our agency, Public Health Seattle and King County, is collaborating with Washington State Department of Health and the Centers for Disease Control. We're investigating 14 reports at the moment of myocarditis among King County residents following a first or second COVID-19 vaccine administration. At this time, it's unclear if the cases of myocarditis are linked to vaccination. The CDC, as you know, is investigating reports nationally and is also in the initial stages of an investigation with Washington State Department of Health and our agency to learn more. At this time, both the CDC, the American Academy of Pediatrics, and the American Heart Association all continue to recommend COVID-19 vaccination for people 12 years of age and older. I'll say a little bit more about the cases we're investigating. We have 14 reports at the moment among King County residents of myocarditis or pericarditis after receiving a dose of COVID-19 vaccine, primarily in the month of May. Of the 14 reports of King County residents, the ages range from 16 to 42 years. 12 are males, 2 are females, and at least 5 patients have been hospitalized. We're not aware of anyone needing intensive care, and there have been no deaths reported to us. We have issued a health advisory to King County healthcare providers to raise awareness about myocarditis and pericarditis following COVID-19 vaccination and asking healthcare providers to report cases both to public health and, importantly, to the VAERS system. And we are also using other databases and surveillance systems to try and understand whether there are other cases that may have occurred that have not been reported, and whether or not we can establish baseline rates for this condition in the population. So let me summarize by saying that most of the cases that we're aware of nationally, including locally, appear to be mild and again occur primarily in young adults and adolescents, more often males than females, primarily following dose 2, but not always. We're aware of cases after the first dose. And the symptoms typically occur within 4 days after vaccination. And now let me just, for those who aren't aware, talk a little bit about what myocarditis is. It's an inflammation of the muscle of the heart. And most commonly, it's a mild inflammation that relates to viruses that normally circulate in the community every year. Viral myocarditis is the most common cause of myocarditis in general. Patients can be asymptomatic and recover quickly, although severe cases can occur rarely. And myocarditis can occur at any age, but most often affects healthy individuals under age 30, and it is more common in males than it is in females in general. Symptoms of myocarditis may include shortness of breath, fatigue, heart palpitations, chest pain or pressure, lightheadedness, swelling in the hands, legs, ankles, and feet, or uncommonly loss of consciousness. So there are a few key points I want to leave you with. There is an investigation that's ongoing nationally in the US, locally in Washington State, here in King County, and as well in Europe and in Israel, to understand whether or not this condition is associated with vaccination, and if it is, to what degree. Now, myocarditis is not a reportable condition, so we don't really know with certainty how many cases would typically be expected, and that's one of the things we're trying to learn, so we can compare that with the number we're hearing about at this time. We do not know currently if there's a link between COVID vaccines in these cases, although that is a possibility. However, since the cases appear to be relatively rare and mostly mild, the benefits of COVID-19 still far outweigh the risk of a rare complication, and that is why the CDC, the American Heart Association, and the American Academy of Pediatrics continue to recommend COVID-19 vaccination for everyone 12 years of age and older. So for example, in the last 60 days in King County, 254 people between ages 16 and 42 were hospitalized for COVID-19. In the last 7 days, 3 children under 18 years of age and 5 people 20 to 29 years of age were hospitalized for COVID-19 in King County. So with that, I think I will pivot back to my closing, and I also want to let everyone know while we're talking about vaccines and vaccinations that we've updated our vaccination dashboard to be more user-friendly and informative. And you can find vaccine coverage on our website now by region, race, ethnicity, and age group. Please check it out. You can Google King County Vaccine Dashboard and find it, or we can post a link for you in the chat. And before I get to the question and answer, I want to take a moment to acknowledge the much deserved recently announced retirement of Patty Hayes, the Director of Public Health, Seattle and King County. For me personally, it has been a privilege and a pleasure to have had the opportunity to work with Patty and learn from her during our tenure together. She's been a remarkable leader and an advocate for improving health for all King County residents across the lifespan, for health equity, for recognizing racism as a public health crisis, and for navigating the department through the rough and uncharted waters of COVID-19. I wish her well, and I'll very much miss working with her. With that, I turn to your questions.
Thanks so much, Dr. Duchin. And once again, if folks have questions, please go ahead and use the raise your hand function in Zoom, and we will make sure to call on you. We'll also try and get a few questions in from members of the public who are watching on Facebook Live. Our first question comes from Jessamine McIntyre. Jessamine, please go ahead.
Good afternoon. Thank you again for your time and taking our questions. Doctor, with these groups of people who are just never going to get vaccinated, and I know Dr. Shaw likes to say adequate vaccine coverage when it comes to getting vaccinated rather than herd immunity, where do you think we need to get as a state to prevent maybe a mini waves or another wave in the future? Do you think we're well on our other side of that mountain?
Thank you, Jessamine. Yes, the issue of herd immunity versus so-called control of COVID-19 is an important one. For herd immunity, really, you have to have the majority of the entire population who can become infected vaccinated. And I don't think that's going to happen in the near future. I think most experts agree. But we can achieve levels of vaccination coverage that will prevent us from suffering the worst impacts of COVID-19, particularly large numbers of deaths and hospitalizations. The most important way to do that is to make sure that our most vulnerable older adults are vaccinated, and we've done a great job with that. And that's why our death rates and hospitalization rates have come down dramatically. But we're also seeing ongoing cases now among middle-aged adults and younger adults. Now, granted, those are less serious with respect to the number of deaths that result and the number of hospitalizations that result, but they still do create a substantial burden of hospitalizations. And if you think about something like this, perhaps combined with influenza season, I think that would tax our hospitals significantly. So I think, only time will tell for sure, because the true risk is really a combination of both the number of people who are vaccinated and the behaviors of the people in the community, whether we take any additional precautions such as improving ventilation and wearing masks among the unvaccinated, and how many people truly remain unvaccinated and what they do, how they interact, how they behave. And then the virus, what may happen with respect to more transmissible variants of concern, how easily they spread and how they may evade vaccine-induced protection. And finally, the duration of vaccine-induced protection, which we don't know for certain yet. So the best I can tell, based on other countries' experience, particularly Israel, what we're seeing in the US, my guess is 70% of the adult population fully vaccinated will provide us with a good degree of protection against major outbreaks and large numbers of hospitalizations and deaths. However, that is a best guess, and I recognize that there's a significant amount of uncertainty going forward, and time will tell. It's impossible to know at this point with certainty. And to the extent that more of us can be vaccinated, this threat will be reduced. Well, let me leave it at that. Hopefully that answered your question.
Yes, thank you very much.
Great. Thanks, Jessamine. Our next question comes from Bellamy Palethorpe. Bellamy, please go ahead.
Thank you, Doctor. Can you talk a little bit more about the variants? I think that's a big question mark for a lot of us, and I was surprised to hear that three-quarters, I believe you said, of the folks who have been diagnosed with COVID are sick with variants. To what extent are the vaccines protecting us from those? Is it just a matter of them being more contagious? And, should we be worried about them as vaccinated people?
Yeah, thank you. Let me just clarify the statement I made earlier. More than three-fourths of the COVID-19 samples that have been sequenced in Washington State are variants. That's a little bit different than saying three-quarters of everyone who has COVID has a variant. However, we know that as new variants develop that spread more readily and perhaps may cause more serious illness, they will replace other strains. So it's totally expected that over time, the variants will be the majority of the strains that occur in the community. It's just a question of which variants and how long it will take to understand, the ones that will become successful. And over time, they may continue to evolve. It would not be a surprise if that happens. So to see an increasing proportion of variants and cases due to variants is expected. Currently, as I said, 97% of our cases are among unvaccinated people. So the vaccinations appear to be providing excellent protection, similar to what they did in the clinical studies. And there have been multiple real world vaccine effectiveness studies showing protection at levels that is very high. And that is comparable to what the clinical study showed. So far, vaccines working really well against the variants that are currently circulating. But we do need to keep a close eye on this. We do need to be concerned about it because variants develop particularly where there's COVID transmission happening, particularly high rates of COVID transmission, meaning many unvaccinated people. And that really drives home the point that although we may be able to protect much of our population currently here in Washington State through vaccination or in the US through vaccination, we won't be safe from COVID, and neither will anyone else until the global situation is addressed adequately with supply of vaccine made available to everyone across the globe who is susceptible and eligible for vaccination. New variants will emerge, and you know how easy it is for infectious diseases to spread. We're just an airplane ride away from any place else in the world right now. And so we have a vested interest not only in vaccinating our own people here locally in the country, but also ensuring that we do whatever we can to increase vaccination rates globally.
So it sounds like you're not really surprised by what you're seeing in terms of variants at this point. It's all within the realm of expectation.
Absolutely. This is expected, and it will continue to be an issue for us. Variants will continue to challenge us. There may be variants that are able to evade some of the vaccine-induced immunity that develop in the future. We're not seeing that currently, but it's something that we very much need to pay attention to, and that's why you're seeing an increasing investment nationally in sequencing across the country to keep an eye on new strains as they appear, and then make any changes that are necessary if we find that vaccine-induced protection is not what it should be against a new strain.
Thank you.
Thanks a lot. Our next question comes from Facebook, and the question is, how does the benefit of the vaccine outweigh the risk of COVID for children when kids are at such low risk of severe COVID?
Well, it depends on the age of the child. Clearly, the younger children, well, very young children, birth to 4 years of age, seem to have relatively high levels of serious illness. But most children, school-age children, have mild illness, recovered, don't seem to develop, a large number of them don't seem to develop the long COVID complications. But adolescents, for example, are at increasing risk. So one way you might think of it is that, adolescents are about 3 times more likely to be hospitalized due to COVID than they are due to influenza. But the risks clearly for all children are lower than they are for adults. Now, children can spread it to adults. Children can spread it to vulnerable adults, just like children can spread influenza to vulnerable adults. So there's benefit in vaccinating children to prevent the spread. But at this point, our vaccination program is focused on adolescents and adolescents and adults do have more meaningful rates of serious disease and in and of themselves worthy of protection through vaccination.
Great, thanks so much. Our next question comes from.
Actually, Gabriel, let me just add one other. I can just provide some hospitalization data for you. So, for example, for children between 10 and 19 years of age, the hospitalization rate is about 33 per 100,000. And then when you get up into the 20 to 29 year age range, it becomes 150 per 100,000 and so on. And the risk increases with age. So 30 to 39-year-olds comparable to the 20 to 29-year-olds. When you get to 40 to 49, we're looking at 253 per 100,000. These are King County statistics. So clearly, children are at less risk for hospitalization and severe outcomes. But they are at some risk, and it's not a risk that people would want to take if they had the opportunity to avoid. And that's why the vaccines were licensed initially for those at highest risk, adult age, and then adolescent age, because those folks and the adolescents are at higher risk than the younger children.
Thanks so much. Tammy Mutasa, please go ahead with your question.
Hi, good afternoon. Thanks so much for your time, as always, Dr. Duchin. My question is, I find it crazy that 97% of our cases are among unvaccinated people. So what do we need to do to convince people to get vaccinated then? Because if I'm hearing this, that's enough to convince me. But I mean, we do know, as Jasmine says, there are people who just are not going to do this. So what do we need to do to convince them if we're seeing these numbers?
Well, it's a very important question. It's one that our vaccination team thinks about constantly. There are about 500,000 people 12 years and older who remain unvaccinated in King County. But people, they're different reasons. And so some of it is convincing, some of it is just providing vaccine in a way that's convenient and accessible. So there are a number of reasons why people haven't been vaccinated. So we are working very hard to make that vaccine available to those who may have to work long hours or don't have good transportation or have other barriers to accessing it. That's one piece. And then there are issues around people who aren't ready to do it for whatever reason. Now, one thing that motivated some people, I think, is the knowledge that by the end of June, most likely, the mask mandates were going to go away. So there will no longer be, a state or a local requirement or a federal requirement for people to wear masks in places like grocery stores and other public locations. There may be for transportation and other special settings, congregate settings, hospitals, long-term care facilities, homeless shelters, et cetera. But for routine community, there would no longer be a mask mandate, which means that if you're unvaccinated, you're likely going to be in close contact with other people who may be unvaccinated and or ineligible for vaccine. And so there will be opportunity for COVID to spread, and masks, which are a major way to prevent COVID transmission, may not be used very much. So that should motivate some people to get vaccinated because they themselves don't want to get sick. Other reasons that some people may be motivated to be vaccinated is because they know it protects others in the community, such as the tens of thousands of people in our community who are immunosuppressed and may not respond to the vaccine, and so remain susceptible to COVID-19 and severe COVID illness. And then, of course, there are the children who, at this point, are not eligible for vaccine. Now, as was pointed out, these children, by and large, do not get severe illness to the degree that adults do, but they or their parents may desire to avoid COVID-19 infection nonetheless. And then there are people who have questions about vaccine safety and other issues related to vaccine development that we try and answer through our community teams and are the information that we push out. So to the extent that if you're aware of people with concerns about vaccination, you can make those concerns known to us. We can try and address them. But I think there's just some people who take longer to make up their minds and are not so-called early adopters. And then there are some who just say they won't get vaccinated. And I think that's obviously true. Not 100% will be vaccinated. And we will have to live in equilibrium with the level of disease that results from having a proportion of the population unvaccinated.
Thank you.
Thanks so much. A couple of questions have come up on Facebook around masks and children. Wondering if you could just clarify a little bit about when and where children ought to be wearing masks and if there are any potential downsides.
Well, I don't want to get too detailed right now because I know that the CDC guidelines are about to be updated on children and masks. Currently, I'll just say that in Washington State, State Health Secretary Dr. Umair Shah recently updated his health order for masking, which includes children and children above the age of 5 who are unvaccinated. Should wear masks in indoor air spaces like other unvaccinated people should. And the state health department currently recommends mask use outdoors as well if 6 feet of distance can't be maintained. I will just say that the risk outdoors is very low compared to indoors. And particularly if there's not going to be sustained face-to-face contact, the risk is extremely low. And I'm anticipating the CDC guidance may evolve to reflect the low risk outdoors, both for vaccinated and unvaccinated people. Clearly, vaccinated people do not need to wear masks outdoors, and they don't need to wear them indoors either, although we've requested that they do that for a few more weeks as we get our disease rates down and allow others to be vaccinated. However, unvaccinated people, even outdoors, if they're close together, particularly in large groups, face-to-face contact over prolonged periods can be at risk. But in most outdoor activities where there's a significant amount of ventilation and space between one another, the risk is low.
Many thanks. I see hands still raised. Do folks have follow-up questions? If you don't have a follow-up question, maybe you could lower your hand, and then I will know. It looks like all the hands have gone down. That means our questions have concluded. Dr. Duchin, do you have some closing remarks?
Yeah, thank you, Gabriel. And again, thank you to everyone who joined us today. We appreciate your taking the time to ask questions and allow us to share information with you so that our community can continue to do such a good job in managing the COVID-19 epidemic. I want to just emphasize today that our COVID-19 outbreak is moving in the right direction. And thank you to everyone who has been vaccinated and made all the hard sacrifices over the past year and a half to get us to where we are today. Getting vaccinated clearly is the most important way to keep us moving towards healthy lives and a healthy economy. However, while our disease rates are still substantial and not all who are eligible are vaccinated, we do continue to depend heavily on one another for community protection, including those highly vulnerable people who may not respond to vaccine because they're immunocompromised from disease, treatment, or medications. As you go forward, I always want everyone to keep in mind that there is uncertainty around changing behaviors and increasing activities that will be associated with reopening Washington, and with what to expect with in regards to the new variants of concern, also about the duration of protection from vaccination, and other things we still don't understand completely about how this virus spreads. So this means that we can't put the COVID-19 outbreak in the rearview mirror quite yet. Nonetheless, the bottom line remains, the more people that are vaccinated, the less COVID-19 will circulate and the safer we will all be. And in closing today, I'd like to remember the words of Maya Angelou, who said how important it is for us to recognize and celebrate our heroes and sheroes. And so I will close with recognition and appreciation for all the men and women who have died in service of our country, and wish you all a safe and happy Memorial Day holiday. look forward to talking with you again next week.
Thank you all so much. And this briefing will be archived on our Facebook page as well as on Public Health Insider as always. Take care and have a good rest of the week.